Well, good afternoon. My name is Carla Chenier, and I am the MCAL Support Coordinator for Families Helping Families. Thank you for being here. Before we get started, I would like to introduce Miss Melinda Elliott, our LaCan leader. She is going to share with you some information about LaCan. Here you go, Melinda.
Hey, everybody. How are you? I appreciate it, Carla. I appreciate you giving me the time to be able to speak, and I appreciate Families Helping Families for all the support that they give LaCan. LaCan stands for the Louisiana Council's Advocacy Network. We are a section of the Developmental Disabilities Council that works on legislative issues or BESI issues. So every year we have community input meetings, which we're fixing to have again this summer, on what issues people with disabilities and parents find are bothersome or don't work right or aren't fair. So we gather all that information and we bring it back to the DD Council, and the DD Council actually decides on our legislative agenda. We did this last year. We've done it every year forever. I've been doing working with LaCan forever. And the three issues that we came up with were funding for Families Helping Families. We have gotten funding for the past 3 years, and we want to get continued funding if at all possible. Raising the night rates for people with home and community-based waivers to the day rate. In that particular waiver, the night rate is $5 less. And if you know anything about home and community-based services and direct support workers, it's hard to get them. You know, you can go to Walmart and get $15 an hour. So bringing that rate up hopefully will let providers be able to pay more of a competitive wage for people that have already been approved for hours at night. It's not everybody that has a waiver in the state, it's just some of them. And then the third thing was the Flexible Family Fund, a very small fund, a very small stipend every month for families that have children with the most severe disabilities. It's only children, to be able to help cover some of those costs. We wanted to eliminate the waiting list, so we were asking for money for that. And, you know, things come up every session that we work on. Same thing this session. So Wallace, if he hasn't already done it, is going to drop the link for you to join LaCan. It doesn't cost anything for you to join. And if you care about people with developmental disabilities or have a disability or are a professional working with people with disabilities, you can join. You're signing up to get emails. Hopefully, you're going to perform some action when you get that email. Generally, the actions are to call your legislator or email your legislator and let them know how this might affect you or people you know. Some of y'all are going to have a really good story around some of these issues that you're going to want to share. I can help you put it down on paper. You can share it in individual visits. We organize individual visits with our legislators. We have a round table every year. We already had the one for this year. Stories are still good. Sometimes it takes multiple years to get some of these things to happen. Some people are going to have the ability and be selected to go to Baton Rouge and testify in front of committees. And then you might just bump into your legislature at the state fair, or what is it we have around here? Rabbit Festival or whatever festival. And you might have 2 minutes to tell your legislator about one of the issues that's important to you. So you'll already have it put together. I have meetings every once in a while where we go deeper into the things that I'm talking about. And I hope you decide to go to that link and join. Any questions? No, we good. Back to you, Carla.
Thank you, Ms. Melinda. Today, we are pleased to welcome our guest speaker, Ms. Letty Goings. She is the Senior Behavior Analyst with McNeese Autism Program. This webinar is being recorded. All lines are muted, so please put your questions in the chat box. However, we ask that you hold most of your questions till the end of the webinar. We will be reading them and giving them to Ms. Goings as she goes along. We ask that you give your full attention to Ms. Goings and help me welcome her. Ms. Letty, you can take it away.
All right, can y'all hear me? Okay. Let me see. Let me share my screen. Okay. Okay, can y'all see the presentation view? Or the
Yes,
full
ma'am.
screen
Yes,
of
ma'am.
it? Okay. Just making sure that we're looking at the right screen. Okay. So thank you for that introduction. Some of you may have attended the talk we did, I believe it was last week or the week before. It was a kind of a collaborative talk, and I only introduced this topic briefly because I knew I was going to be giving this more in-depth talk today. So this is, if you saw what we did a week or 2 weeks ago, then this is going to be a little more of an expansion on what I touched on then. So we're going to talk about independence and why it matters, and specifically as it relates to individuals who are young adults, older adolescents, transitioning, that critical transition period between adolescence and adulthood. So our learning objectives, we're going to identify how the social rules change for adolescents and young adults. We're going to identify ways to foster independence and why fostering independence is important. We're going to identify some reasons why fostering independence is significant to the transition into adulthood. And we're also going to identify some ways that we can safely practice these independent skills and why it's important to practice these skills. Okay. So a little bit of backstory for me. I started working with this population probably about 3 or 4 years into being a licensed and certified behavior analyst. I realized that it was kind of an under-researched and underserved population at that time. And it's the adolescents and young adult population is a population people are either going to really, really love working with, or they're really not going to love it much at all. And that's okay, because it's not for everyone. I think they're great. I think they're funny. I think they are capable of so much. We're going to talk a little more about that as we go on. Actually, I'm having a technical difficulty here. Let's share slideshow. Okay, can y'all see that now?
Yes, ma'am.
Okay, back on track. Sorry. I don't know what happened there. Okay. So I was in the process of giving y'all some background information on how I came to this realization that the population that I most dearly enjoy working with is one of my favorite populations. I've been a BCBA for 10 years. a board certified behavior analyst. And most of the information that I'm going to present today is coming from my experience as a service provider. But a lot of what I am going to be presenting does apply to parents and other caregivers. So keep that in mind. It's not just this information that I'm giving from this professional standpoint. It can be applied for a wide variety of people. I've worked in the field of applied behavior analysis, the field of ABA, for a total of 12 years. And I've worked all of these years in the field at the McNeese Autism Program. Been here a long time. I was a student at McNeese, came up, and I just never left. I loved it so much. And around 2017, which was the time that I realized that I really did enjoy this population, I developed the Bridges program. And that was kind of a play on words to bridge the gap between adolescence and adulthood. And it started mostly to give these individuals an opportunity to practice and learn social skills. And over the years, the program kind of evolved to meet the needs of the individuals that it was seeing. So now it's not just social skills. We work on employment skills, leisure skills, functional living skills. We kind of incorporate as much as we can for those individuals and their needs. So that's just a fun thing that I enjoy doing with the McNeese Autism Program. So one of the biggest things is that social rules change. It's kind of one of those things that maybe we can't quite pinpoint it when exactly do those social rules change, but it's almost like an overnight thing. So we spend all of this time teaching these hard and fast skills, these hard and fast rules, these concrete skills, teaching these little ones, wait your turn before speaking. You always have to share. Sharing is caring. Raise your hand before talking. Raise your hand and wait to be called on. You have to let your friend sit next to you. We teach them a lot of almost like passive compliance, tolerance. But it's like we don't give them, we forget that they're going to get older and that things are going to change. And all of a sudden you have a preteen and they're an older adolescent or a young adult, and we've spent all this time teaching them these hard and fast rules that we haven't given them any skills to navigate those soft skills of socialization. We taught them to tolerate all these things. We put in accommodations to help them navigate through things to facilitate that toleration. But we realize, oh my gosh, we never taught them how to politely decline to do things, or we never taught them to advocate for themselves if it is something that, they really don't want to do, or they really don't want to be a part of. And arguably, those skills are just as important as those concrete, hard and fast skills that we spent all that time teaching them when they were much younger. Side note, I'm in the clinic today. We are fully operational. So if y'all hear noises and commotion, this is just our everyday normal noises. So I apologize if it's distracting. So now all of a sudden our social rules have changed. We have to teach them nuance. We have to go and we have to not necessarily unteach everything that we've taught, but essentially teach them these highly nuanced things that aren't all of a sudden black and white anymore. We have to teach them that they don't have to do all of these things. Wait your turn before speaking. Okay, but what if we're all talking together in a group? What if we're having a spirited discussion and everyone's just kind of offering their 2 cents all at once? That's okay. You must always share. Okay, but what if you're using an item and the individual that is asking for it won't be affected if you don't share it right at that moment? They can easily troubleshoot another way, just as you could easily share it, but you don't really want to. So how do we teach them to politely decline or navigate that situation? sharing is caring. Okay, if I don't share this item, does it mean that I don't care? Because that may not be the case, but they don't know how to voice that. They don't know how to navigate that. Raise your hand and wait to be called on. Okay, but again, going back to having a spirited discussion among friends, that's going to be weird if they just raise their hand and their friends all kind of look at them and they're like, why are you raising your hand? Oh, well, I was taught that I had to raise my hand before to speak, before I had to speak. Always allowing someone to sit next to you. Okay, well, do I have to let someone sit next to me, even if I would rather keep to myself? What if I don't want to be involved with what's going on? What if I would rather sit over here to myself and kind of observe what's going on? Have we taught them how to navigate those things? Along with navigating this, all of a sudden the social rules have changed. A lot of times the expectations have changed as well. Performance expectations are going to change across environments, but most of the time what we find is that these young adults are hardly ever prepared to meet these expectations. It's almost like the expectations have changed, but nobody let the individual know. They're just expected to perform and meet these competencies. One day they wake up, they're just expected to be able to navigate all these adult responsibilities without much room or tolerance for error. And it's not their fault. We just didn't prepare them. On the flip side of expectations changing, sometimes your expectations are going to change regarding the skill levels and capabilities of that individual. I have found that in my personal experience, just from programming for individuals like this in their day-to-day, a lot of their skill sets and capabilities are very, very underestimated by their parents and caregivers and teachers. And I mean, even me as their practitioner. Sometimes there's just a really, really, really present underestimation of what they're actually able to do. Another thing that is challenging is that some environments now have a tendency to become less accommodating as these individuals get older. So supports that we once had in place for these individuals when they were younger, they might now be considered to be intrusive or isolating for that individual. So how do we navigate still keeping some supports in place while also meeting the needs of the individual and all the stakeholders around that are also involved in this individual's life? And then speaking just from my experience as a practitioner, specifically as it relates to ABA services, most insurance providers are going to stop paying for ABA when these individuals turn 21. We call that aging out of services. So that leads to a decrease in treatment options for these individuals when they get older. Sometimes there's poor collaboration between service providing agencies. So sometimes we have to collaborate with other entities in the community or maybe other service providers, some allied health providers. And so sometimes that collaboration drops off and it's really poor. And so that makes it hard for everyone to be on the same page in providing what these individuals need. And then there are some disability related factors that can also hinder some treatment. Sometimes, the severity of any kind of impairment or any kind of disability, like a physical disability, sometimes those factors really can be a hindrance to treatment options as well. So I say all that, and I realize that I just gave what I feel like to be a lot of challenges and a lot of bad news, but the good news is that we can help ease these growing pains during this transition time. There are things that we could be doing as practitioners and providers, and there are things that parents and caregivers can be doing to help ease the growing pains of this critical process. And the first one that we're going to talk about is the 5-year rule. So I learned there's a BCBAD in the field. His name is Dr. Peter Gerhardt, and he at one time ran, I'm not sure if he still does, but he ran a school for individuals who and this school focuses on functional living skills. And I was watching him do a presentation at a conference one time, and he talked about what he calls the 5-year rule. So what is the 5-year rule? That is when you start planning for transition, you're going to identify the individual's chronological age, and you're also going to identify the developmental age. And then you're going to fast forward 5 years. What are they going to need to know in 5 years? Any kind of skills that are going to be necessary and applicable to them, that are going to be socially significant to them. Skills that are going to be critical, that they're going to need to know for the rest of their life. Identify those skills and start laying the groundwork for those skills now, so that 5 years from now, they should be able to perform them proficiently. And I know that sounds really intimidating, but it's okay, because as they say, Rome wasn't built in a day. You can start laying that groundwork, and you can start troubleshooting how to teach those skills. You can start identifying those skills. You can start figuring out the order that you might want to teach those skills. Maybe you want to start with the most critical and teach those, and then maybe sprinkle in some of the less critical ones. There's a lot of different ways that you can teach those things. So I recommend using the 5-year rule and looking at what these individuals are going to need in the next 5 years and starting from there. The next thing that I would do is talk to your providers. Talk to your provider, or talk to your providers if you have more than one. So a service provider could be anything from an ABA provider, a speech language pathologist, an occupational therapist, counselors, any kind of school counselors, teachers. Sit down and have a conversation with them. Talk to them and tell them that you are concerned about a successful transition into adulthood. Another important question that you might could ask them is, do they have any kind of experience in working on skills related to independence and transition? Ask them if they can start incorporating these independence related goals in the treatment plans, especially if they haven't been doing so already. Some practitioners might be already doing that, but if they're not, then you can start asking them to help you identify those skills that they might need in 5 years, asking them to start doing assessments and how to identify those things. And we'll touch on that in a little bit as well. But talking to your child service providers and expressing to them that you are concerned about a successful transition into adulthood, and that you want to start working on these skills now. And on top of that, you should also talk to others that your child sees regularly. And that could include, again, teachers. Ask to know what they're doing in the classroom. Some teachers might be incorporating independence related skills. If they're not, then advocate for it. Ask, tell them that that's what you want to focus on, and tell them your concerns. Being informed is the only way that you're going to know how to fill in the gaps of what your child could be missing. If your child is employed, talk to their employers. Ask your child's employers to know about the areas that they may be having trouble in. Also ask them, about the areas in which they're excelling, because it is important to know where there might be trouble areas, but on the flip side of that, it's also equally as important to know what they're doing right. We should be drawing attention to that as well. Talk to their coaches, talk to their tutors and mentors, anybody that sees them outside of, school or anything like that. If you have a sitter, if you have a nanny, or if you're involved in the church and they're involved with a youth pastor or other church leaders, talk to them and ask them what they see and, what could be helpful. All of these individuals that have contact with your child, they're going to know, they're going to see, and that could potentially be helpful information for you as well as you're planning this transition to adulthood. Okay, so the next few slides, I have taken screenshots of some assessments that I myself would be using to assess where we need to, what skills we need to be teaching and skill level. Just keep in mind that this is specific to me as a behavior analyst. So different professionals might have different assessments. So you would just need to ask what those professionals would be using. But the first thing that I might start with, we call it the AFLS, but it's the Assessment of Functional Living Skills. And there are several different ones, but one of them that I would probably be pulling from would be the community participation skills. Now, also keep in mind that in these assessments, some of the material that they're going to be assessing may not be applicable for our community, for this individual. I'm trying to think. There are some that are more, there are some questions in there that are geared a little more toward like big cities, big metropolitan areas. And that's just not our reality here in Lake Charles. So some of those things just might not be applicable. And that's okay. I've definitely pulled from different AFLS assessments and used those as a guide for skills treatment for some of the participants in my Bridges groups. It's just a good guide to see where they are and what we hope to see in the future and where we should be focusing our time and teaching those skills. So we have the community participation skills, basic living skills. So that's going to be things like self-care, leisure skills. We also have the independent living skills assessment. We have the home skills assessment protocol. So the home skills, that's going to look like, can they cook meals? Do they know how to lock the doors? Some of them have questions related to, can they do fix minor problems with tools? So can they use tools? Can they operate tools like a hammer and things like that? So it all depends on what is applicable for the individual at the time. We have the AFLS vocational skills assessment. So that's going to be looking at things that are going to help guide them to different jobs, different things that are available to them as it relates to employment. Another one that I might look at is the essential for living. And the way that it's described, it was described when I did training for the essential for living, is that the essential for living was written for individuals who have moderate to severe disabilities. So around age 7 or 8, assessing whether or not a more functional living skills based curriculum will be more appropriate for this individual rather than an academic, like a strictly academic curriculum. And a lot of the teaching in the essential for living is because these individuals need to build a life. They need skills that are going to carry them throughout their life. And it's broken down into 4 types of skills. So your must-have skills, your should-have skills, your good-to-have skills, and your nice-to-have skills. So your must-haves and your should-haves are going to be the most critical skills that you teach these individuals that are going to carry them throughout the rest of their lives. It's a very neat assessment, but it's very, very, very detailed. So it is something that takes a lot of training for a behavior analyst to understand and be able to run with competency, but it is a good one. We also have the transitions curriculum. We've dabbled with the transitions curriculum in the Bridges program before. There's 3 parts to it, and it's all geared toward that transition from high school to adulthood. What are we going to need to know to navigate this transition? And then we have the circles curriculum, which is very cool in teaching individuals personal space, personal safety. We teach them how to classify people in their lives based on the color of the circle, because each color means something different. I like the example that they use in the clip. It's okay to hug your mother. It's not okay to hug the mail carrier. Teaching them that there are some people that we might just wave to versus that we might hug. It's okay if you don't want someone to hug you. You can tell them no. You can give them a fist bump or a high five, but it's all about teaching them about relationships and ultimately personal safety. That's a really cool curriculum as well. And then I've used the social skills improvement system, mostly with individuals who have done the Bridges program, and it's a neat assessment in the sense that it gives me a good idea of what skills they have and where a parent hopes, what skills a parent or a caregiver hopes that they can get from a program. There's, I believe, a parent form. There are student forms. So if the student is able to read and write, they can fill one out for themselves. And those are always interesting for me. I like to see what a parent answers versus what their child answers. I like to compare those. But these have been a good assessment tool for me to gauge program effectiveness. So what were the scores before they came into the program and what were the scores after? Did we make any changes, any kind of socially significant change? And then we have the socially savvy. So that's for younger kids. So that would be like maybe preteen, pre-adolescent kids. And that's a pretty neat assessment that targets a lot of cooperative play, sharing, which I know, we talked about sharing is caring, teaching these individuals, but cooperative play and sharing information and things like that. That's a really a neat assessment that we've used before. And then and some of these are blurry. I'm very sorry. I tried to find clearer pictures. I might look at the VB-MAP barriers form just to see what are the barriers that these individuals have that might prevent them from gaining these skills, and what am I going to kind of work around, or how are we going to teach them even though they might have some barriers. So that's just a tool that might help me guide my programming. So again, this is all if your child has behavior analysts, these are all things that the names of things that just might be thrown out for how the practitioner might want to assess the skills. So you're a parent, you're a caregiver, you've been brainstorming with your child's treatment team, you've been thinking about this transition at home. Now what do you do? What are we doing now? Well, we practice. So practicing skills, especially under the care of a behavior analyst or another practitioner in a safe place, is probably the most important aspect of all of this, because we want them to be able to practice the skill until they have it, but we never want to just throw them out in the world and not have enough practice in a safe place. So we're almost always going to practice these skills in some kind of a supported environment until a certain criteria is reached. We might take this skills practice to the outside environment eventually, but support is still going to be present for a good portion of that. We're never just going to throw them out into the world after they've had one or two practice opportunities. We really want them to be able to practice these skills in a safe place and be able to ask questions and things like that. There's two distinct advantages to doing it this way. So again, it's going to give the individual the opportunity to practice that skill while being able to ask questions or troubleshoot something that just doesn't feel right, or maybe they are having trouble with this particular part of this process that they're learning. Okay, well, let's figure out how we can teach that. Let's break it down a little farther. Maybe we need to change, some aspect of this skill. But it also gives the professional or the practitioner the opportunity to observe any issues that could arise. It gives us the opportunity to assess the need for any kind of other elaborate supports. It also gives us ways to assess different ways to teach the targeted skill, because sometimes maybe the way we're trying to teach it is not the best way for that individual. So those are the advantages of using supported practice opportunities. Some other advantages, ideally, we've got varying levels of support, and those are going to be faded out over time. But the collaboration with other professionals and other stakeholders is going to go a long way. Maybe we are doing some job shadowing with an individual, and maybe we need their input on what is most feasible for a support for this individual in the job environment. So that collaboration and that buy-in is going to help that individual. And we also want to eliminate the likelihood of just throwing them out into the world with no prior support or any kind of prior practice of these necessary skills. And I've seen that happen, and it was not successful. So we want to eliminate that where we can as much as possible. And then, what's the most important piece of this transition puzzle? I'm going to say it's the individual. That individual should be involved in planning their own life. They should have the tools to be successful in reaching each of the next steps of their life. They should have an appropriate level of autonomy in planning their own life. Now, again, the emphasis is on the appropriate level of autonomy, because I do understand that every individual situation is different. Not every individual is going to have, complete autonomy and control, and that's okay. It's the appropriate level of autonomy for that individual. Their input on things that are going to affect their quality of life matters. And we need to make sure that they know this, because again, we've spent all this time teaching them hard and fast skills and teaching them, compliance and to just do things because someone told you. But we need to also make sure that we're giving them the tools to be able to advocate for themselves. And some tough conversations may have to take place, and it's not fun, but those conversations may look like, okay, what's next for this individual? Are they going to continue to live at home? Can they continue to live at home? Is it going to look like, living in a group home or a facility? These are all tough conversations that may have to take place at the time of transition, but it's important to have those conversations and to ask those questions and to, try to kind of roadmap it a little bit. That way it's not all overwhelming at one time. So some quick notes about transition. So transition is giving an individual the tools to be successful at becoming independent. Transition is not sending an individual out on their own once they reach a certain age, because they're an adult now. Again, I've seen this happen, and it was not successful. Transition is giving them those tools and walking them through it and giving them opportunities to practice. If they don't have the practice opportunities, then the likelihood that they're going to be able to perform the skill is pretty low. Transition is teaching an individual important and meaningful, socially significant skills that will serve them as they live their life. Transition is not teaching an individual a skill just because it may be cool to have or just fun to teach. These skills that we're teaching these individuals are going to follow them throughout the lifespan. They're going to make or break their life as a functioning adult in society. We want to make sure that we are teaching them those skills to take care of themselves. In some cases, the skills to take care of their own finances, their skills to keep a job, to drive a car, to get from point A to point B, to find transportation, those skills that are going to allow them to be successful in society. Transition is finding the appropriate way to teach an individual. So we're going to meet them where they are. We're going to tailor all of these things that we're teaching them to the individual. We are not going to give up on teaching a skill because the way that we want to teach the skill or the way that we have been taught to teach the skill is the only way. No, if it's not working for that individual, it's okay to go back to the drawing board and find another way to teach the skill. We can use picture schedules. We can use schedules. I mean, everybody has an iPhone, a smartphone. We can use reminders and timers and things like that. It's okay if we have to go and troubleshoot a skill, troubleshoot how to teach a skill, because everything is tailored to the individual. And it's all about finding the right things that are going to work for them. So I've referenced my experience a little bit with working with the adolescents and the young adults, and how it's my favorite. However, there have been some challenges that I have encountered as a practitioner. Most notably is getting coverage for their ABA treatment from their insurance company. I have found that to be a little bit hit or miss. So what I mean by that is the older that these individuals get, the more challenges I face with getting approval from the insurance company for teaching social skills or functional living skills. They didn't want to pay, saying that it wasn't medically necessary. And so I didn't take no for an answer. I sent back the diagnostic criteria of what an autism diagnosis is, and what are the other symptoms that are socially significant and medically necessary. And with a little bit of pushback, I've been able to get insurance coverage approved. And it's gotten better over the last few years because I think that the research base and all of that has grown in the field significantly over the past few years, which is a good thing because when I first started out on this journey, that was not the case. And now we've got more research articles, we've got more conference presentations about transition, we've got comprehensive transition programs at universities and colleges in the state of Louisiana, which is huge. We've never had that before. And some recent research indicates that individuals who complete some kind of transition plan are better prepared and better equipped for the required levels of autonomy in their lives, the required levels of independence and socialization that are going to be required for these individuals as adults. And that data was self-reported. So these individuals reported that, which is huge. Everything is trending in the right direction, I think, as it relates to transition and facilitating transition for individuals. And I'm really happy to see that as somebody who was kind of stunned that we just were surprised that these young kids grow up and they become teenagers and they become young adults. That shouldn't be surprising. We should have already been planning for that. And so that's really encouraging for me as a practitioner. And I hope that this has been encouraging to everyone on this webinar. I think what I'm going to do is I can generate a list of everything that I shared, the assessments and everything, and I can send that to Carla, and she can disseminate that to you guys if y'all would find that helpful. These are a few of my references. I do have a few more references, but I can add that when I send my slides. But that's all that I had. And I'm happy to answer any questions.
Letty, is there an age limit like with the insurances where they're more apt to allow these types of diagnosis codes to be accepted?
An age limit, I don't think so. The only age restriction that we've seen though is specifically as it relates to autism. Most insurance companies don't cover ABA treatment after age 21.
Okay.
Yeah. That's very frustrating because it is, in my experience, these individuals don't just stop having a diagnosis. I
Correct.
argue that this is a critical period of time where more support would be necessary. It would be helpful. And it may not be at the level of 30 hours a week, 40 hours a week that maybe a 4 or a 5-year-old would have, but it would still be helpful, even if it was just 10, because we can do a lot with that. And it would help in the long run because if they can be more self-sufficient, then that's less that you would have to pay maybe like a PCA or some other supported individual to do the things if you just taught the individual the skill. But yeah.
We have a couple of questions. Oh wait, they're moving. I'm sorry. Are the ALFS only available to practitioners? If so, where would an adult go to get the assessment done?
That is something that a practitioner would be using those. So if your child is seeing a behavior analyst, I'm not sure what counselors or social workers, I don't know what all they use, but for sure, if your child has a behavior analyst, ask your child's behavior analyst about the AFLs. Ask them if they have a copy, ask them because it's a very thorough assessments. I have sent some home with parents and they've been like, whoa, this was really thorough. And I'm like, yeah, they ask a lot of questions. They're very thorough. Some of that is not applicable and that's okay. But I would ask the practitioner themselves if they have a copy of any of the AFLs.
And are there any social life skill programs available to North Shore other than, I'm sorry, my screen keeps moving, available to teens with intellectual disabilities other than autism?
And where was that? North Shore?
That are on services on North Shore, on the North Shore.
Is that over by New Orleans?
I'm not sure,
right?
Just North Shore.
Mandeville area.
Mandeville, yeah, that's what I thought. I know that there are a few. I think I know that there's one called Brennan Behavior Group, and maybe I think Aspire is ringing a bell. AST. But I can find out. I'm not entirely sure, and I'm not entirely sure of the age groups that they serve in that part of the state.
Do you know if there's a waiting list for the Bridges program?
Yeah, because it's based on staffing. So last summer, just full disclosure, it was a staffing related issue. We weren't able to run the program. So we're gonna know more in the next couple weeks as it relates to staffing and if we can pull that off.
And would they contact the McNeese Autism Program to find out more information there?
Yep. Yes.
Okay.
So I don't even think I put that on my slides, and I should have. Yes, our main office, the main number for our clinic, and they would probably speak to Tressa, and she would take their information. You're gonna need a diagnosis. So a diagnosis or proof of a diagnosis, your insurance cards, and fill out an intake form. and a prescription for services. Those are going to
Okay.
be the main things that you'll have to have.
Okay, well, I tell you what, we would like to thank Ms. Letty for attending and doing this webinar for us. It's been very informative. If you have any additional questions, you can always call our office at 337-436-2570 or email us at info@FHFSWLA.org, or you can contact Ms. Letty through McNeese. And we ask that you please complete the survey today. All the webinars will be surveys today. The webinars will be emailed to you. Thank you and have a great day. We appreciate it, Miss Letty. We
Yeah,
appreciate
thank y'all. And I apologize for that.
That's
technical
okay.
difficulty.
Hey,
So sorry.
it happens. We love the information you've given us. Thanks so much.
Thank y'all for having me.
Okay, bye-bye.
Bye.